Do you get burning in the chest after meals? Think it's acidity? It could be GERD, and if ignored, it can damage your food pipe. Heartburn is common, but when reflux happens again and again, it becomes a disease, not just a nuisance. That sour taste in your mouth, nighttime coughing, chest burning may not be random. Your body may be warning you about GERD. Many people treat reflux with antacids for years without asking why it keeps happening. Today, let's fix that. Hello, everybody. I'm Dr. PK, and today we are talking about GERD, which stands for gastroesophageal reflux disease. This is one of the most common digestive problem in the world. Many people call it acid reflux or heartburn, but GERD is more than an occasional episode. It happens when the stomach contents repeatedly flows backwards into the esophagus and causes symptoms or complications over time. In this video, I'll explain the types of GERD, the causes, how to prevent it, how doctors diagnose it, and most effective treatment, including lifestyle changes, medications, and when procedures or surgery may be needed. What is GERD? Normally, food travels from mouth down to the esophagus into the stomach. At the bottom of the esophagus, there's a muscular valve called lower esophageal sphincter, LES. This valve should open to let food in and then close tightly to prevent the stomach acid from coming back up. GERD happens when this barrier becomes weak, relaxes too often, or pressure in the stomach pushes contents upward. Occasional reflux can happen to almost anyone, but when reflux becomes frequent, causes bothersome symptoms or leads to inflammation and injury, this is GERD. Common symptoms include heartburn, sour or bitter taste in mouth, regurgitation, chest discomfort, and sometimes difficulty swallowing, chronic cough, hoarseness, worsening asthma symptoms. GERD can show up in different ways. Let's simplify it into practical types. Non-erosive reflux disease, or NERD. This means that person has classic reflux symptoms, but the doctors look with endoscopy and they may not see any visible damage to the esophagus. Symptoms are real, but lining looks normal. This is actually very common, NERD, non-erosive reflux disease. Erosive esophagitis. In this type, acid has irritated the lining enough to cause inflammation or erosions or ulceration in the esophagus. This is the form many people think of when they hear acid damage. Complicated GERD. Some people develop complications like a stricture, meaning narrowing of the esophagus, bleeding, ulceration, Barrett's esophagus, a condition where the lining changes after long-term acid exposure and may increase the risk of esophageal cancer. Extraesophageal or atypical reflux. Sometimes GERD may not present mainly as a heartburn, but instead may have a chronic cough, throat clearing, hoarseness, laryngitis, dental erosion, or asthma-like symptoms. What causes GERD? It does not come from just one cause. It often results from a mix of anatomy, lifestyle, and body chemistry. The main issue is usually a weak or overly relaxed lower esophageal sphincter. Several factors can increase reflux: large meal that increases stomach pressure, obesity, especially extra abdominal weight, pregnancy because of hormonal changes and pressure from the uterus, hiatal hernia when part of the stomach pushes upward through the diaphragm, lying down too often after eating, smoking, alcohol. Certain food or drinks may trigger fatty meals, chocolate, caffeine, peppermint, some spicy acidic food. Not everyone has the same triggers. One person may react strongly to late night meals, while another person's main issue is weight gain or hiatal hernias. This is why treatment has to be individualized. How to prevent GERD? The good news is that many of the cases of reflux improve with the smart habits. First of all, avoid overeating. Smaller meals are easier on the stomach and reduce upward pressure. Second, do not lie down for at least 2-3 hours after eating, especially after dinner. Nighttime reflux is a big problem for many people. If you're overweight, even modest weight loss can make a big difference. Guidelines support weight loss in overweight or obese patients for improvement of GERD symptoms. Also elevating the head of the bed can help those with the nighttime symptoms about 45-degree. Avoid smoking, reduce alcohol intake, pay attention to food triggers, acidic food, spicy food, for some people, late meals, fried food, heavy dinners are far more important than tomatoes or spices. Prevention is especially important if you have a recurrent heartburn, night reflux, or chronic cough. How is it diagnosed? Usually, it's historical information and symptoms. If a person has classic heartburn, regurgitation without alarm symptoms, doctor usually begin with lifestyle measures, trial of acid suppressing medication, rather than doing tests immediately. But test becomes important when symptoms are severe, atypical, persistent, complicated, or not responding to usual treatment with acid reducer. The diagnostic test is upper endoscopy. A thin, flexible camera is used to look at the esophagus, stomach, and upper small intestine, and this can show erosive esophagitis, ulcers, stricture, Barrett's esophagus. It is especially important if someone has difficulty swallowing, bleeding, anemia, weight loss, recurrent vomiting, long-standing symptoms with concern for complication. Ambulatory reflux monitoring, this measures how much acid or reflux reaches the esophagus over 24 hours or longer. It's useful when diagnosis is uncertain and symptoms continue despite treatment or surgery is being considered. Esophageal manometry, this test measures the muscle function and pressure of the esophagus. It's not the main test for GERD, but often used before anti-reflux surgery and when swallowing problem needs evaluation. Remember, chest burning is not always reflux. Heart problems can sometimes mimic GERD, so severe chest pain should never be ignored. Treatment usually includes lifestyle changes and medication, antacids, as needed. They don't heal inflammation. They control symptoms. H2 blocker like famotidine, they reduce acid production and help the milder cases. But they are not generally as effective as PPI for healing esophagitis. PPI, proton pump inhibitor, strongest common medication for lowering stomach acid, for example, omeprazole, pantoprazole, and lansoprazole. There are main medical treatment for healing erosive esophagitis and controlling GERD symptoms. Usually taken 30 to 60 minutes before meal, often preferably before breakfast. When medicine is not enough, surgery is an option for selected patients, those with the proven reflux and severe regurgitation or large hiatal hernia, or those who want an alternative to long-term medication. Anti-reflux surgery such as fundoplication may be considered. Now, I'm going to talk about the red flag symptoms, which are very important. Please seek medical attention if trouble swallowing, pain with swallowing, vomiting, black stool, unexplained weight loss, persistent vomiting, chest pain, or symptoms that are not improving. GERD is common, but it should not be ignored. The right treatment depends on type of reflux, the cause, the severity, whether there are complications. Many people do well with a weight loss, real and meal timing, and avoiding late night eating, and properly use medication. But when symptoms persist, testing may be needed. If you found this useful, share this video, repost it, and thank you for watching. I'll see you next video.